Hey guys, Davin Lim, board certified dermatologist. Today we'll be talking about a super common condition. It's called double chin to under chin fat, also known as a submental fullness. So double chins are super common. Most of the time it's due to genetics. So you can actually have a normal or very low body fat, but still can have an undefined jawline with double chins. So it's very important to understand whether it's laxity or due to submental fullness secondary to what's known as pre-platysma fat. Your dermatologist or plastic surgeon can easily do a pinch test, and the pinch test can reveal whether it's excess skin, too much fat, or a combination of both excess skin and too much fat. Now, when it comes to treatments, there are basically 4 treatments that are widely available. First of all, Kybella or Belkyra. This is a form of deoxycholic acid. It's a bile acid that's injected. I'm not a fan of this treatment, and here's why. Most of the time you require between 2 to 4 sessions, right? And it's dependent on the amount of inflammation that you will get. So deoxycholic acid is a natural derivative of what's found in bile acid and can be injected into the mental area or submental area here to treat fullness under the chin. Problem with this is that it has a huge reaction. So what we call a bullfrog reaction. So you may look like a bullfrog with a lot of swelling and a lot of bruising. That usually subsides between 4 to 6 days. The injection itself, because it's an acid, it's really painful. However, we can do blocks and we can also give sedation, and that makes it a lot more comfortable. The downside, like I say, if you need 2 to 4 sessions and each time you have a downtime of about a week, once you add it up, let's say worst case scenario, 4 sessions, you're out for 4 weeks. So does it work? Yes, it does. Is it my favorite? No, and the last time I used it was probably about 4 years ago. Now from there you can use what's known as non-invasive cryotherapy, in other words, cool sculpting. Cool sculpting is a good device because the pocket or the applicator itself can go under the chin. If you have submental fullness and if it fits into the applicator, chances are it's going to work, right? But most patients will require between 2 to 3 treatments for optimal outcomes. And the more applicators that you have, the more accurate it is because we can position the applicators, and what happens over a period of about an hour is that the device itself drops the temperature to about 0 degrees, and that basically freezes fat, and the cold fat basically dies, right? And that resolves your double chin. So that's the second thing, which is called cool sculpting. The third is basically HIFU, or high intensity focused ultrasound. For many years, the maker of things like Ultherapy and Ultraforma, they deny that HIFU causes a fat loss. And when you read and when you look at the, reviews as well as on Reddit, you'll see that many times people would say, I've lost facial fat because I've had HIFU, or high intensity focused ultrasound, or Ultherapy, or Ultraforma. Now we know now that is a very good treatment for submental fullness, because once it's pulsed deep, anywhere between 1.4 to 5 mils, it may cause fat loss. So that's a very good treatment because it can decrease fat, but at the same time tighten under chin laxity and improve your jawline. The fourth treatment, which is my go-to, is a simple procedure, at least simple for most dermatologists and plastic surgeons. That is liposuction. Liposuction takes about half an hour to 40 minutes to do. What I do is I make 2 little incisions here, and we use what's known as a cannula. So a cannula basically sucks out the fat, and the downtime following this procedure is super quick. It takes about 2 days to recover. You do need to wear a wraparound at night, basically to help support your chin area and to make sure that the side effects such as bleeding is markedly decreased. So why do I like submental liposuction or chin liposuction? It's this: because when they're actually performing it, we're actually removing the fat cells itself. So we're not looking at a secondary process, for example, inflammation from Kybella or Belkyra. We're not looking at a secondary inflammation due to cold. We're not looking at breakdown of fat due to a device, but what we're doing is physically extracting the fat. So the great thing about liposuction is that it can also stimulate your collagen cells, in other words, your fibroblasts and your collagen under your chin to contract. This gives a snatched jawline. It's a sharper, more well-defined jawline, together with removal of fat itself. And when you look at all the costs of all these non-invasive devices and methods, when it all adds up and you look at the downtime following each of this, it just makes sense that liposuction is probably the treatment of choice for most surgeons. Guys, I hope you liked that video. It's short, it's sweet, and I hope that helps you in your decision about how to choose treatments for your under chin